since moving to Peterborough, I know you've had a lot of experience, even beforehand working with neurological people living with neurological conditions, in addition to the aging population. Given the fact that balance, gait quality, walking, falls prevention, tripping, is such a big issue amongst these populations. In your clinical opinion, from what you've seen, what are the most common risk factors that may lead to falls in your aging population?
Yeah, that's a great question. It's very multifactorial, I think, right? It's very complex. There's a number of different things that can go into a fall. It's not just balance. It can be, a home environment, past medical history, medication use. There's many different things, and generally, medical professionals put them into 4 different categories. So first of all, you have your biological risk factors, natural aging process, any health conditions that a client may have, maybe an acute illness, even like a urinary tract infection, vertigo. All those things can lead to dizziness and a higher chance of falling. And then you have some issues such as balance and gait deficits that could again lead to higher chance of falling. Chronic health conditions, Parkinson's, diabetes, arthritis, those type of things. And then there's a whole other side of it as in cognitive impairments,
Right.
Dementia, people living with brain injury. And then you have a whole other list of other physical factors, poor vision, muscle weakness, reduced physical fitness. All these things can lead into a fall, and that's just like the biological risk factors, right?
Right.
So it's very complex. And then you have the whole behavioral risk factors. So maybe somebody's choices that they're making, such as
Right.
Use or not using their walker, their cane, excessive alcohol use, fear of falling, footwear, clothing. There's so many different things that can go into it, right? Even like a behavior choice such as, climbing a ladder. If you break that down, there's a lot that can go into that, right? So if someone's not making the right behavioral risk factors, if they don't have the proper physical skills or supervision support there, that can be another big risk factor.
Right.
And then you can even go into the social and economic risk factors. Does a person live alone? Do they have the help that they actually need? Are they able to access appropriate gait aids, shoes, etc.? These are big factors that can all lead into it. And lastly, the environment, so where somebody's living, the community that they're living in. Do they have good curbs or good sidewalks around them? Is that the snow and the ice being removed in their part of the city? And then within a home, things like the rugs, carpeting, electric cords, other tripping hazards that are there. All these things can come together. It can just be one of these things, or it could be, a combination of all these things that can lead to higher risk of falls in the aging population or the neurological population.
Right. I mean, off the top of your head, you kind of listed a ton of stuff. And I feel like the general public, and even professionals and self-included, we tend to put a huge focus or lens on, that biological factors, right? What's someone's past medical history, or did they break their XYZ, right? Are they coming off of a surgery kind of thing? And we're really good at focusing on that. And I find the way you've described it, there's these other factors that, although they might not be specifically, in our scope to address on a one-on-one basis, they are definitely things that you're identifying. So that way, if you're kind of in that person's home, or if you're in their residence, you kind of can spot these things really, really quickly, and at least help them navigate, which I find is sometimes those things I think get lost in a clinic setting, especially if you don't see them, right?
And if you address them, it gives at least attention to those issues when you're with the client, right?
Yeah.
So that you can think about ways that you can problem solve around them, and give the client more confidence, right, to not have a fear of falling if they're already addressing some of these things that are in their home.
Right. And it's almost like, sometimes clients feel, that the professional is more in command of that, getting them quote unquote like better from their chronic health condition or their balance and gait deficits. But if they can take control of the, environment, right? Like, oh, okay, we're going to get rid of all these scattered rugs kind of thing, or newspapers on the ground kind of thing. That's at least one little green check mark in the right box, right?
Yeah,
and then like
exactly.
maybe, and then if you do a bang up job on educating them on, hey, look, anytime you're navigating around this area of the house, I'd really want you to be holding on to the handrail or like your single point cane. Then you kind of like check box another portion of the green check marks, right? So yeah, I mean, definitely sounds much more like falls risk, much more complex than just what the biological issues are. And 100%. Right, I mean, yeah. So, unfortunately, after a fall, there are common injuries that do occur. What, in your clinical experience, what are some of the common injuries you have seen? And have you noticed any trends with fear of falling? And within that context, how does physiotherapy and physiotherapy treatments, how does that assist with all those things related to falls?
Yeah, as far as like the common injuries after a fall, unfortunately, if a fall does happen, it's usually in the first place that hits the ground, right? So if you could think about it, if you fall to the side, it'll likely be a hip injury or a hip fracture. If you fall backwards, pelvis, sacrum involved. And then if you fall forwards, it's likely, the wrist when you reach out, just try to stop yourself from falling. And if you hit the ground pretty hard, there's a high incidence of a wrist fracture there. So those are some of the most common injuries after a fall. And unfortunately, it has been shown that injuries that result from falls in an older population often lead to hospitalization, increased disability and mortality. So that's where physio, starts to come in, because clients are hospitalized often or require surgery, or just that period of when they can't be up and mobile. It's often shown that it's often chronic pain and decreased independence happen after a fall. So that's where physio comes in, right? A good rehab plan, a good assessment of what is needed, and a good kind of reaching out to other team members. Maybe occupational therapist needs to come in, or kinesiologist to help with exercise programming. I think this is where we can kind of have the most influence after a fall. We've talked a little bit about prevention, and now, after an injury does occur, I think we're really needed in this area. Mm-hmm. And you talked a little bit about like the fear of falling. I know this can, increase after a fall does happen.
Totally. Yeah. It can change someone's life, right?
Exactly. Yeah. And so I think physios can do a really good job on that front as well. Just taking, a client where they're at, it's very individual for all the different clients that I've worked with, right? Mm-hmm. You got to kind of start where they're coming from. And you kind of have to show them what they can do, then focus on the things that they can't do, right? So even if it's just, practicing standing without holding on to something while you're there, you're in a supportive position, they feel comfortable, so they're going to gain confidence from that. And then just giving them like easy things that they can do on their own to help practice, their balance and gain some confidence with that. And then you can progress things from there. So I think, I think physios can play a huge role in kind of trying to get a client back to where they were at before the fall and before the injury.
Totally. Yeah. I mean, like I think we're always on the side of falls prevention, like, stop it before it happens. And then unfortunately, there's always the chances of that still occurring, but we play on that kind of gentle line where it's like, you want the client to acknowledge that there is a risk of falls, right? But at the same time, you don't want to like instill the continued fear of falling in the client. And then exactly. We're asking them to practice these exercises and or movements that are like pretty tricky, right? That help with balance. Like, how do you clinically go about, trying to kind of like balance that with some clients that might, continue to fall into that little bit of a loop? Or is it really just like a case by case basis?
Yeah, I think it is oftentimes a case by case basis. How much support they have in their home? Are they going to be able to, practice some of these more difficult exercises that you give to them in a safer environment? Just seeing where they're at and doing, reassessments whenever you see them to see if they're making improvements. And then just giving them, confidence in what they're doing. I think everyone needs that confidence after any kind of injury. Like we all have been there trying to, regain function or independence after an injury, and it's scary. So sometimes I've even, taking clients into a pool so that they can feel comfortable and get those movement patterns back before trying different things in their home on the land. So that's one strategy. I think just, going through those risk factors again, like we had talked about. So, having a checklist, like you said, what can we do in your environment that's going to help create a safer space for you to feel more confident, right? If there is a high risk of falling, high fear of falling, then we got to try to make that fear as low as possible. And that's one of the ways that we can do that. It's just kind of going through that checkbox of what can we do in your home? What can you do as from a gait aid perspective, or it might just be like better lighting or better carpets or that kind of thing. Or talking to their medical team about the medications that they're using or their nutrition, hydration, all that can play a factor.
Totally. No, those are some good answers, man, and really thorough responses to like something that I think often gets shrugged off as like, well, this person's this age and it's kind of natural to lose your balance. And here we are, right? It's always like the boogeyman for the aging population. And yet if we have even a sliver of more like advanced notice or at least like planning, and being a little bit more proactive, I think people can really make a difference in their own physical health and also probably like the mental health and the fear of falling, right? So, I mean, I think, that's, is there anything else you want to add towards this, falls prevention, fear of falling, and how people end up getting better if they should, experience a fall?
Oh, I think we've covered a lot of it. I mean, like you had just said, like if someone does have that fear of falling, another thing we can do is to help show them that they can get up from the floor. So that's something I practice as like a prevention or a pre-fall type of idea, right? Getting up from a chair, getting up from the floor safely. All those type of transition movements just give people more and more confidence to feel safe in their own home. So that's the one other thing that I wanted to mention, but I think that, we've covered most of it.
Awesome. Well, Dave, thanks so much for your time. I know this discussion on falls is, really thorough, and it's always good to hear from you. I think, in our, hopefully our next discussions, we'll have another topic that we can bring to mind. But for now, thanks so much. And thank you so much for providing awesome services throughout Peterborough and the surrounding area.
No problem. Thanks for all the great questions and discussion, Hoong. That was awesome.
Awesome. We'll talk to you soon, mate.
Okay, take care.
Bye.